Okay, Dr. Nissan, before we get into more phone calls, why don't you tell us a little bit about migraine headaches?
Well, migraine, it literally means half a head in Latin. It's a very common condition. About 12% of people in the United States, as well as the westernized world, suffer from migraine. So we have about 320 million people in the United States. There's about 36 million or 37 million that have migraine. The majority are undiagnosed, so at least 50% do not know it. When they have it, it can be very severe with nausea, vomiting, light sensitivity, sound sensitivity. It usually occurs on one side of the head, but it can occur on both sides of the head up to 10% of the time. And it usually is worse with physical exertion and activity.
Hey, welcome to Doc Talk. What's your question for our experts?
Hi, I had a quick question. So sometimes I go to workout and sometimes I go for jogging, and I feel like after maybe half an hour or 45 minutes of workout, and all of a sudden I start feeling like my left eye or right eye is getting blurry, and I start getting headache. So is it something related to migraine or something else might trigger that?
Great. Dr. Chaudhry?
Sure. So exercise-induced headaches are actually fairly common, and they can happen after you do a strenuous workout. The important thing is to look out as to what features of headache you have. So it's important to talk to your physician, neurologist, or even a headache specialist to see if you truly have migraine or if it's induced by, like lack of energy, you're not taking enough food, or even dehydration can do that.
Welcome to Doctalklive. Go ahead with your question.
Hi, my question is whenever I expose to cold or whenever I expose to hot, I immediately get headache. So is it related with migraine?
So weather changes can definitely induce headaches. As to if they are truly migraine or not, this is a discussion where, we can have in the clinic. But if you do have migraine, it's going to be one-sided headache, throbbing pain, and you would be sensitive to light and sound with it. Extremes of temperature can do that. However, migraine patients mostly prefer to be in a colder environment just because they are intolerant to heat.
Welcome to Doc Talk. What's your question?
Hi, I have two questions. Number one is I do have migraine, but I did LASIK for my eyes last year, and after that it started. So is that something related to migraine?
You can have visual changes also associated with migraine. Sometimes procedures on the eye may affect you, whether it's things like glaucoma procedures, laser surgery, LASIK, things like that, but you still got to make sure that the ophthalmologist looks at this as well and rules out other forms of problems with it, because they're usually independent of each other, but the eye can be affected during migraine.
Hi, welcome to Doc Talk Live. Go ahead with your question.
I want to know what happens in the human's head when there's a headache. I mean, what exactly is happening scientifically? And when you take some medicine, how does it help to get rid of the problem, like a blood thinner or those kind of stuff?
So this is a pretty broad question, and I'm not sure if I can really go too much in detail. But in general, patients with migraine have a little bit of a hyperexcitable brain. So a little bit of changes in their lifestyle environment can trigger it. So if you have a headache, in general, your pain sensitivity and the threshold of having pain is definitely reduced. So small changes can give you pain. The key term here is cortical spreading depression, which is a medical term basically, and I don't want to go too much in detail about that. But when you take a pain medicine, the goal is it decreases inflammation and it also decreases the chemicals which are giving you headache.
Welcome to Doc Talk. What's your question?
Hey, I have a good question. If I have 1 or 2 glasses of soda and I get a headache maybe for 3 or 4 hours, I don't know if it's high intake of sugar which is causing that. The doctors answer that?
So it depends what kind of soda you're drinking. So if it's a diet soda, it does have aspartame, which is artificial sweetener. Also, caffeine itself in a lot of patients can induce headache. Also, there are a lot of energy drinks which have significant high amount of caffeine, which can, kind of give you headaches a couple of hours after having it. So kind of watch out for those drinks. I would not say it's the sugar. It's usually the artificial sugar, but not the real sugar in the drink, which is probably giving you the headaches.
Folks, if you're just tuning in, we are discussing migraine headaches today. The number to the studio is 972-235-5555. Our call board is full, so keep trying if we don't get you the first time around. Now, Dr. Chaudhry, is there a certain patient demographic or population that's more predisposed to migraines?
Studies indicate 12% of U.S. population, as Dr. Nissan mentioned, is affected by migraines, and definitely women are affected more than men. The peak productive years for most patients, that is between 30 and 40, is the time when migraines affect. So that means patients really lose productive time. It diminishes their quality of life.
Okay, let's take a live call. Hi, welcome to Doctalklive. Go ahead with your question.
Hi, my question is basically, could you talk a little bit about headaches or migraines revolving around hormonal changes with women, especially after having kids?
That's a great question. You know, when we look at kids below the age of 13, there's one boy for every girl that has migraine. After the age of 13, when puberty kicks in, there's 3 girls for every boy. So we know that hormones play a big factor in migraine. When you have children, usually the first trimester of pregnancy can be rough, and then it gets much better. But then after delivery of your kids, you can go back to having more headaches. So we know that drops in estrogen play a factor in this, and there's always going to be more women in those reproductive years, like Dr. Chaudhry was talking about, that in their 30s, 20s, 30s, and 40s, they're going to have more migraines at that time.
Welcome to Doc Talk. What's your question?
Hi, my name is Prerna. I want to ask regarding migraine. I do have migraine. I want to know what should I do to subside it when I have the episode of migraine.
Okay, I think our caller was trying to ask what can she do to try to decrease the pain or prevent these migraines.
So there are a lot of treatment options, and it depends how many headaches you have. So if you're really suffering from frequent headaches, we do not recommend using too much of over-the-counter medicines because it can actually make your migraines worse. So, using medications such as triptans, which is used more as an acute treatment for migraine, is extremely helpful. It's not available over the counter, and that's something which you should discuss with a headache specialist or your neurologist. Also, you may have to be on a daily medicine, which we call preventive treatment, which you can use if the headaches are too frequent. And the best way to do it is to keep a headache diary or a migraine calendar and to see if you're really suffering from frequent headaches.
Okay, welcome back to Doc Talk Live, a live call-in health show brought to you by Zyga Healthcare Group, a leader in providing senior living, home health care, and hospice-related services throughout the entire DFW Metroplex. Our second sponsor is Dallas Renal Group, a physician group that Dr. Vic Prakash and I belong to. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on the DallasRenalGroup.com or on the Dallas Renal Group Facebook page. This is Dr. Paul Cespedes, and I'm co-hosting today's show with Dr. Vic Prakash. We're live in the studio with Dr. Priyanka Chaudhry and Dr. George Nissan discussing migraine headache. The number to the studio is 972-235-5555 to be part of the conversation and to ask your question to our experts. Now, right before the break, we had a call, and they were just kind of asking very broadly what exactly causes a migraine headache.
The main cause of migraine is hereditary. It's genetic. So if you have a parent or both parents that have migraine, it's very likely that there's a chance that you'll have it, even going to your grandparents, aunts, uncles, cousins. So we look at that mainly. When we do a history of a patient, we always look at family history of migraine. There's other things, too. There's triggers that can lead to migraine, things like weather changes, different variations in hormone cycles, stressors, mood changes, sleep disorders. There's a lot of different factors that go in, but heredity is really the main cause of migraine.
Hey, welcome to Doc Talk. What's your question?
Hi, my question is a follow-up to the question that I asked about the hormone issues relating to headaches. I was wondering what are some of the treatment plans or suggested treatments where you're sure that that's kind of the issue?
So as we discussed, hormone is not actually the complete picture. There can be a lot more reasons why you're having headaches. So the treatment can vary from just using something over the counter if you have infrequent headaches. However, if the headaches are frequent, and by frequent I mean at least once a week, and it's affecting your ability to work, then using something like triptans, which is the rescue medication for headache, is important. Also, as I talked about before, using a daily medicine is also key. oral contraceptives actually have not been shown to prevent migraines. So it depends with your OBGYN and talking with your neurologist as to if this is a good option for you or not.
Hi, thanks for calling Doc Talk Live. What's your question?
Yeah, hi. Actually, I've been suffering from migraine for quite many years now. So I have two questions. One was that I suffer from bowel and indigestion-related aspect when I suffer from migraine. So is that kind of a normal thing? And secondly, what's the specialization of doctor I need to visit in order to kind of take the medication?
So there are some inflammatory disorders which can be related to migraine, like fibromyalgia, inflammatory bowel disease, and there could be some correlation, but you should speak to your primary neurologist. So in general, if the headaches are affecting your ability to work, if you get sensitive to light or nauseous during any of these headaches, it's important to talk to your primary care physician to think about going to a neurologist or a headache specialist, because some of these headaches can actually be bad and you may need imaging like an MRI or a head CT to look into this.
Okay, while we were on the break, we had a caller, female caller, who said she's 42. Every morning she wakes up with a headache. And she was wondering, could it be related to hormones? She has 3 children. She takes, it sounds like ibuprofen every day, significant amounts of ibuprofen. Could one of you address what might be causing that daily morning headache?
Yes. When you take ibuprofen or other over-the-counter medications such as Excedrin, BC powder, Tylenol, when you start taking it more than once or twice a week, you can get what are called rebound headaches, which is also called medication overuse headache. It's fairly common in the population because when you look into the average pharmacy or grocery store, you see how many tablets are available over the counter for headache and other pain syndromes. Most people are grabbing that first. And what happens is when you wake up with a headache, which a lot of migraineurs do wake up with a headache, some of them get them later in the day, if you start taking more and more medications, the actual medications may be leading you to have more headaches later on down the road. So it's important to see a specialist or a neurologist at that point to take further investigation into it.
Okay, another question we had during the break was, are there any natural remedies for migraines?
As far as natural remedies, we talk a lot about magnesium, which is available in its elemental form. It's called magnesium oxide. You can buy it over the counter. It can cause some diarrhea initially when you start taking it, so it's great for people with constipation, but it also has some double-blinded controlled trials that show it to be effective for migraine prevention. This is more for an episodic migraine sufferer who doesn't get that many migraines. Riboflavin, which is also called vitamin B2, is another option between 200 to 400 milligrams over the counter. Another thing that we sometimes use is coenzyme Q10, which is used for other types of disease states, but it also can be effective for migraine up to 100 milligrams twice a day.
Folks, you're listening to Doc Talk Live. We're discussing migrainous headaches with our experts today. Call our studio, 972-235-5555. Dr. Chaudhry, we've had so many callers today ask about headaches, and obviously a lot of people are suffering from this. What is the progression? Who should they see first? When should they request a neurologist? When should they request a headache specialist specifically?
So that's a very good question. So in general, if you're having headache at least once a week and you feel like it affects your ability to go to work or it affects your ability to spend time with families or go to social events, it's important to talk with your primary care physician. You can also call Baylor Comprehensive Headache Center directly, because we do see patients who have headaches without even referral, and we can determine what kind of treatment plan you need. Also, it's important to note that if the headaches that you have are with nausea or you have vomiting with them, there can be other reasons for the headaches and not just migraine. And at that point, getting a brain imaging is extremely important.
All right, let's take another live call. Go ahead with your question.
It's extremely. My question is.
If you could turn down your radio, please.
You have a crazy headache, and is marijuana really a good medicine to relieve that pain?
Well, marijuana hasn't really been shown to be effective. There are some pain syndromes where marijuana is shown to be effective, but when you look at it with migraine, all you're doing is sort of masking the symptoms for a few hours, but you're not really taking away the source of the pain, the excitability pattern in the brain, and While some people say they may feel better for a few hours, it's not really a recommended treatment for that because long term it's not going to really be beneficial for you.
Hey, welcome to Doc Talk. What's your question?
Yeah, I have one question. Can someone get rid of migraine, or it's just a preventative? So if someone has migraine, the treatment what doctors suggest, they are preventive kind of, or someone can get rid of it.
So studies indicate that very few percentage of patients, once they have chronic migraine, become episodic, which is less frequent. So the likelihood that you're going to be chronic migrainer is high. However, once woman hits menopause, the things change and the headaches may change. You may get less headaches, you may get more headaches. There is no clear consensus as to how your headaches are going to go. However, if you're on a preventive treatment and you're doing good on preventive treatment and you're not having side effects, in general, we do recommend that you stay on preventive for long term. If we do have to wear you off of medicine, you should do it under doctor's supervision because sometimes wearing off of preventives can actually worsen your headaches.
Hey, you're live on air. What's your question for our experts?
Yeah, hi. I wanted to know if the migraine occurrence also is there in kids or in children?
Great question.
So migraines can occur in kids as well, and it's important that you do talk to your pediatrician about it because when kids have symptoms, most parents actually don't think they're just faking it. So sitting down with your kid and really inquiring as to what kind of symptoms they are having is important. Now, kids may not say that they're sensitive to light or, they're sensitive to noise. They may just go to a dark room. They may just want to avoid television. They may feel kind of nauseous, may lose an appetite. So sitting down with your kid and really having this conversation is extremely important, and also making sure that you talk to your pediatrician because there can be other things that your kids may have which can lead to headaches.
Hey, welcome to Doc Talk. What's your question?
Hi. So I have a question. When I go out in the sun, when I have to, even in the home, the sunlight coming through the windows, and if I've been looking at the windows, the sunlight, my eyes are sensitive, and then my headache gets triggered. So I wanted to see, this is happening every time for me. So I wanted to see if this could be a migraine, or what would be the cause for it. It's more triggered from the eyes. My eyes are sensitive to the sunlight.
It's a great question. Migraine sufferers definitely have very severe sensitivity to light and sound, so it definitely could be part of a migraine syndrome. Not everyone has a full-blown headache, but they may have nausea, light sensitivity, sound sensitivity as part of their maintenance, and that sometimes is worse than the head pain itself. You may want to also consider looking at a tinted fluorescent tint that you could buy online. Actually, there's a tint called FL41 that could be used for migraine sufferers. You could use it both indoors and outdoors to help prevent some of the sunlight from bothering you.
Wow, I didn't know that you could actually tint your windows like that. That's very interesting. Now, Dr. Chaudhry, Dr. Nissan, both of you have told us about medications to treat migraines. Are there any procedures that you can do to help treat them?
Yes, Botox, which originally came out for plastic surgery use, for cosmetic use, actually was found to be very effective in the prevention of chronic migraine, which Dr. Chaudhry had talked about, which is people that have more than 15 migraines a month. These are the really severe cases where they're having more days than not. And Botox is administered into the front of the face, the temples, and the neck and shoulder regions. And we usually will do that every 90 days, and it usually starts to wear off after about 80 to 85 days.
So besides those, Botox is the only FDA-approved treatment. And besides those, there are some other treatment options which are not FDA-approved, but some patients can benefit from it. So something like occipital nerve blocks or sphenopalatine nerve blocks are the procedures which we do at our Baylor Headache Center, which can be really effective. And determining if you're a candidate for one of those procedures will be with the discussion with your headache specialist.
All right, let's take another live call. Hi, welcome to Doc Talk. Go ahead with your question.
I have one quick question. I guess there was a study published maybe a couple of months ago that there might be some correlation between a migraine and the heart disease or stroke. I just want to know how much it's correlated, and I don't know how big that study was.
Yes, there's been a lot of data primarily with migraine, with aura, and stroke. Aura is where you see zigzags or flashes of light about 30 minutes before the onset of a severe headache. Only about 15 to 20% of all migraine patients have auras, but of those, they are at slightly higher risk of stroke. There is a slight correlation with coronary artery disease or heart disease and migraine as well, but it's usually you have to factor in other factors like high blood pressure, high cholesterol, the age of the patient, and family history, and it's not as clear cut as it is with the stroke risk.
Hey, welcome to Doc Talk. What's your question?
Yes, hi. I'm having a question. Instead of taking a medication for a migraine, is that going to be addictive? And is any exercise can actually able to help beside the medication?
So the good news is there are non-narcotics treatments. So at least in our Baylor Headache Center, we incorporate everything as non-narcotics, which basically means you will not be addicted to it, but you will have to take them in order for you to prevent your headaches. And most of these drugs are actually called just modifying drugs. So basically they work on some chemicals in your brain which are giving you headaches, and that's what they decrease the inflammation and they prevent the headaches from happening. Now, exercise in general is very important, and it's been shown that moderate exercise at least 2 to 3 times a week can actually reduce your migraines. So yes, exercise is a great thing to do for your headaches.
Dr. Nissan, before we wrap up here, one last question. What kind of lifestyle changes can somebody make if they suffer from migraine?
Lifestyle changes are extremely important in migraine, especially exercising. I usually tell patients to exercise at least 4 days per week, go to sleep at the same time and wake up at the same time, even on the weekends. Avoid electronics at night like iPads, laptops, TV, and things that may be stimulating and may distort your sleep patterns at night. Also, we recommend, proper diet, staying away from nitrates and other foods that may be triggers for migraine, and avoiding excessive caffeine is very important. I also recommend in the summer months to drink a lot more water so you don't get dehydrated as well.
Okay, we're approaching the end of our show. Remember to log on to our website, doctalklive.com. That's DOCTALK live.com to get more information about our next week's experts. Now, Dr. Chaudhry, Dr. Nissan, any last-minute information you'd like to give our listeners, and also where can they see you?
Yes, Baylor Comprehensive Headache Center is part of Baylor University Medical Center. Our office is off of Central Expressway and Park Lane. It's right in the northwest corner of Park, across the street from North Park Mall. Our phone number is 214-820-9272.
Fantastic.